Ladies and gentlemen, to start with, on 26th of June 2009, following the swelling up of my ankles, I went to my GP's surgery to get the results of some tests. I was told I had nephrotic syndrome and some sort of leukemia, but that I was not to worry. I should still be around in about a year's time. Well, my name is Rupert Beazley, and this is my CLL experience. I'm very pleased to be here today, 7 years on, to give you hopefully a positive view of my CLL journey. I want to let you know some of the mistakes that I made and perhaps give you a few ideas that may help should you find yourself in a similar situation. I'm sure that some of you have your own stories, but thank you for listening and sharing mine. Out of interest, could I ask just for a show of hands of those who have CLL but have not been treated? That's quite interesting. Great. I don't use the word yet, I'm honest. So thank you. Right. Just to give you some background, in 2009, I was leading a fairly normal life. I was aged 48. Happily married with 3 teenage children, 2 dogs, and 5 newly born puppies. Flat coats, if you're interested, to avoid any questions at the end. Just to complete the picture, I was involved in my own business. I ran my own grounds maintenance business, which I'd started about 8 years earlier, employing about 24 people. I was pretty fit. I used to run a bit. I was also a non-smoker, never had, and I only drank in relative moderation. And as a typical bloke, I was fairly reluctant to go to the doctor. Well, I thought that my swollen ankles were due to old injuries of twisted ankles reacting to me being on my feet a lot whilst carrying out some summer line marking, putting in athletics tracks for schools and so forth over the Easter holidays. However, I had to be gently persuaded by a good nursing friend of mine to go to our GP. And so off I trotted to the surgery with little or no concern at all and undertook a blood and urine test. My GP, who was a very good friend of mine, was actually on holiday. So I saw a locum doctor. And I remember sitting down in the surgery and looking at her, trying to explain my situation, realizing that all was not good. And once she said that she thought I had nephrotic syndrome, which as an aside is what Jonah Lumu had, the rugby player, and some sort of leukemia, I just stopped listening. This is going back to where Claire was talking. I only remember the statement, "Don't worry, you should still be here in a year's time." Well, this is where I made my first mistake. I was basically to go to the GP on my own. My very supportive wife has always since come along with me, primarily to listen and take notes and ask all those sensible questions that never seem to occur to me at the limited time I have in front of my GP or consultant. I don't know about you, but unfortunately, I don't seem to be able to take in all the information against the background noise in my head when I hear words like leukemia, chemotherapy, bone marrow biopsy, and so on. And I'm sure I'm not alone. So let me take you through my timeline. On June the 26th, 2009, I was diagnosed by my GP with chronic lymphocytic leukemia, kidney problems, nephrotic syndrome, and I was referred to a renal specialist, Dr. Ramesh Naik, at the Royal Berks. And the main question that Dr. Naik wanted to understand was whether or not these 2 illnesses were related. And I was quite interested as well. In July 2009, I was admitted to hospital for a week and underwent various tests. And I was also referred to a haematology specialist, Dr. Stuart Mucklow, to investigate the CLL and confirm the initial prognosis. Stuart was excellent about explaining about the situation and suggested I look at the CLL Support Association website to get more information. And that is where I started my crash course in learning about the disease. Amongst all the tests, I had to have a kidney biopsy and a bone marrow biopsy. Both were done under local anaesthetic, and both, although very uncomfortable, were okay. And at the time, there wasn't a great deal of understanding as to whether or not these two illnesses were linked. However, I was quite lucky. An expert from the States was over in the UK, a Professor Glassick, and he was consulted by Dr. Nake, my renal specialist, and between the two of them, it was decided it was highly likely that they were linked, although nothing definite could be established. However, a course of chemotherapy was recommended. So, 6 months after my original prognosis, I started chemo. Well, I remember my first intravenous chemotherapy session very well. It deliberately started very slowly, and after being warned that I would feel some odd sensations, it was established, luckily, that I wasn't having any adverse reactions. And subsequently, it all went well. Chemo continued for 6 months, 6 sessions at monthly intervals, and the drugs were FCR, the fludarabine, the cyclophosphamide, and the rituximab. With these and all the other drugs to assist me with my treatment for my various conditions, my next mistake was not to have a clear understanding of what drugs did what. And exactly when they should be taken. Well, my then 13-year-old son came to my rescue, making me my drug chart spreadsheet, which I now understand you can download some apps to help you with this. So I think he missed a financial trick there. A further mistake, again, which Claire mentioned, was to eat the breakfast my wife very kindly made me every morning. Neither of us knew or had been warned that grapefruit and oranges would cause an adverse reaction. And I couldn't understand why I was struggling every morning, trying not to throw up and finding it difficult to stand up because of dizziness. It wasn't until the second session that we were told by the nurse that grapefruit, marmalade, and my drugs just didn't mix. I think the most difficult part of the chemotherapy were the 4th and 5th sessions. And it wasn't the intravenous drug that was the problem, it was the cyclophosphamide and the fludarabine tablets that were the main challenge. They became really difficult to swallow without gagging. But I got there, and the 6th session was easy because I knew it was the last. So on June the 16th, 2010, I had my final chemotherapy session. And as it happens, it was my wife's 50th birthday. All was well, and I thought I was on the road to recovery. Or so I thought. However, within a month, I started to find it very difficult to climb stairs and walk long distances. Part of my chest and legs became very large due to retention of fluid. I also became quite breathless, and in September 2010, I was diagnosed with heart failure. I went for a CT scan and then an MRI scan, and I was referred to a cardiologist, and things weren't looking very good at all. I was admitted back to the Royal Berks and stayed there for 5 weeks, slowly getting worse. Basically, the right side of my heart was operating at less than 5% efficiency, which is not great for my running. And to cut a long story short, it was discovered that the problem was that my thyroid had stopped working. So my endocrinologist, a 4th consultant, put me on a course of medication, thyroxine, and I started to slowly recover. The question I have, which remains unanswered, shame Claire's not here, but it can't be proven, I understand, is whether the FCR chemotherapy treatment and the heart thyroid failure were linked. My suspicions, especially given that I had been a fairly fit sort of a bloke, is that they were. Anyway, a fortnight later, I was discharged from hospital. And by March, I was able to walk a decent amount, a few hundred yards with a walking stick, far better than the 6 paces I could just about manage back in October when I left hospital. I'd reduced my drugs from 19 tablets a day to 2. I'm now on one. I was then sent for more tests at the Royal Brompton Hospital to see if I needed heart surgery or a pacemaker. Fortunately, or unfortunately, I wasn't suitable for a heart transplant because of my recent condition through chemotherapy. At the time, I was still in atrial fibrillation, an irregular heartbeat. And despite that, as part of the test at the Royal Brompton, I managed to walk and jog for 12 minutes on a treadmill. This had been unthinkable a couple of months previously. Mid-April 2011, my medication was then adjusted to get ready for DC cardio, which is basically the jump start, where they zap you with an electric current to get your heart beating back in rhythm. However, guess what? A few weeks later, I contracted shingles. And as anyone who has had shingles, it can be very painful. And actually, for me, it was probably the most painful part of this whole episode. And unfortunately, is still occasionally with me today. Unfortunately, the symptoms for the shingles started on a Friday, and I couldn't get to see my GP until the Monday. And that made it so much worse, as I didn't start any antibiotics in good time. Anyway, the result was they had to postpone jump-starting my heart. Well, in late May that year, I went back to get checked on the recovery of my shingles, only to find, miraculously, that my heart had dropped back into sinus rhythm all by itself, much to the amazement of the cardiologist. Personally, I put this down to a lot of positive thinking and determination. I'd just become completely fed up of not being 100% fit, as well as not being particularly keen on being electrocuted. By September 2011, miraculously, my heart was almost back to normal, and I was discharged for a year with no heart checkup needed for another year. In December 2011, the doctors confirmed that I was now in remission on both fronts, the nephrotic syndrome and the CLL. So 18 months after my initial diagnosis was a big sigh of relief. Finally, in May 2012, I had a consultation with a Dr. Pennicutt, who's based at the Churchill Hospital in Oxford, to look at the potential cause of my condition and further treatment options should my CLL return. These were further chemotherapy and a potential bone marrow transplant. However, happily, since then, no further treatment has been required, and long may that last, especially as with time and medical advancements, my options are changing. So what have I missed out? Well, during chemotherapy, I had pretty much managed to carry on working 3 weeks on with 1 week off. I had a few side effects, a few bouts of sickness, no loss of hair, no more than I originally had anyway. My toenails are still a bit of a mess. Nothing, though, that really concerns me, apart from the odd bout of pneumonia. Prior to undertaking chemotherapy, I was determined to stay positive, and I took advice from a friend and embarked on a number of things which helped us tackle the whole saga. We made a decision to let friends and family know of my predicament, even though all my children were going through important exams. I know this may not suit everyone, but it worked for us, and we found out who our real friends were. We deliberately kept away from all doom and gloom merchants, those who sap your positive energy, dementors as Harry Potter calls them, and there were quite a few of those around. I used visualization as a motivational tool, and I taught myself to visualize future happy events with myself being there. Such as my daughter's graduation. And there we were, a few years later. So whenever dark thoughts entered my head, and it took a bit of practice, but I put a large imaginary cross through them to block them out of my mind. Finally, we accepted as much help as we could whenever it was offered, from doing our shopping, cooking our meals, sorting out our Wi-Fi, or whatever. This was incredibly helpful for my family because when I was actually laid up in hospital, after all, it was easy for me. I was just resting in bed. One thing I did, I kept copies of all my notes in a file, including my blood tests to hand, and I take them with me to all my appointments, even now. I was often surprised by the system, or lack of it, the lack of communication, the lack of IT capability, and the lack of interaction between different health centres. This was especially noticeable when I had a heart scare and was rushed by ambulance to the JR hospital. It's only 25 miles away from the Royal Berks, where I was originally treated, and we live halfway between the two. But because they're under different authorities, we had to take the JR medics right back to square one so they could understand me and my condition. And I still have visions of my wife frantically photocopying my notes for them at 5 in the morning. And subsequently, as a result, I was in hospital far longer than was needed. During my heart failure, I had a series of MRI scans, which, as I'm slightly claustrophobic, seemed to last for ages. In fact, they were only 45 minutes to an hour. But if you are even slightly claustrophobic and need an MRI scan, can I suggest a couple of things that help me? If allowed, use a pillow so you can see out the bottom. It makes quite a difference. That's the bottom of the tube. Secondly, use your mind to do something distracting. And I mentally took our dogs for a very long walk along the North Cornish coastal path, which we love. And it certainly helped, although I found it quite exhausting. Like you, I'm sure when I was diagnosed, I kept asking, why me? Why did I contact CLL? Well, although I have many theories, many personal theories, I'm not sure that any of these thoughts are particularly useful. So I've learned to accept the situation and not to dwell on it, using my energies to focus on continuous recovery. Having now had 6+ years in remission, with regular 6 monthly checkups, travelling to and from the Royal Berks, life is a lot easier. However, I'm now part of their Project Dawn, where I get reminders for blood tests through the post and just have to book a 5-minute appointment with my GP to take 2 tubes of blood that they then send off for analysis. I get the results back a few days later, and this system makes it so much less onerous. No longer does it feel like such a big event looming in my diary. So what have I learned that may be helpful? I certainly have a very different outlook on life. I take time to look at the world a little bit more closely rather than rush around and take it for granted. I try not to get too sucked into the ever seemingly busy lives of our modern generation. There again, I am a little bit more impulsive, although my wife tells me that could be just going through a midlife crisis. I sold my business because I couldn't continue running it effectively. I found it very stressful. Although 4 years ago, I set up another business, however, this time with no employees. I now help owners of small businesses to achieve what they want in life, whilst also helping them to develop strategies to reduce the risk of things such as long-term illness affecting their business. In terms of CLL, I'm back on watch and wait. We've alluded to it before, but why on earth they call it watch and wait, I shall never know. Obviously, it was christened by someone who's never been on this side of the fence. Using the word watch tends to imply that you're continuously looking out, and wait tends to imply that you're expecting. Well, I'm certainly not going to wait for CLL to come back again. I prefer to think of it as something like monitor and carry on living. Make the most of every single day. Thank you. Any questions?
Yeah. Any questions for Rupert? Obviously, forward.
Great.
Oh, that was very good. Thanks very much. Oh, hold on.
Sorry.
You said you went straight into treatment. What was the treatment criteria? What time period were you going into treatment?
Basically, I went into treatment 6 months after my initial prognosis, or diagnosis, and they couldn't separate my comorbidity, as it were, between the kidneys and the leukemia, as to which one was affecting which. So they decided to treat the leukemia, and that actually had an effect on getting rid of the nephrotic syndrome. So I was quite lucky in that respect, that they were obviously linked, which is good in many ways.
Okay.
Thank you.
Thanks very much.
Thank you.